with Dr. Nikita as a resident, when I was in Dato Asim Hospital, it was a great learning and opportunity. After I have exited, then I have no chance to learn from her again. But through this course, I have learned a lot more. And because I work in a quite my hospital, the caseload is quite low, so I didn't get a chance to see a lot of cases. So this is a great chance for me to learn more. Thank you, Dr. Nikita.
In this patient, what you see here is that again the breasts are very dense, extremely dense breast parenchyma, and you see that there are a lot of microcalcifications in both the breast. Most of the microcalcifications are diffusely scattered, amorphous with some punctate and coarse calcifications.
I thank you. I thank you for organizing this. It's very informative for me. It really boosts my confidence, and I learned a lot from you. You have given many important points in assessing the mammogram of especially those high-risk patients and even the screening. So thank you so much.
It was really a good course, and it was very helpful to me also because I could see where my blind spots are, because the routine work-wise we may not get such cases or even such feedback.
If anybody had any experience of previous CAD, you would be very surprised to see that how even in the last case when there are some asymmetries, there is a calcified fibroadenoma, the AI does not pick up. Somehow this AI, with better understanding of machine learning and deep learning, the false positive rate is much lower, which is very good. Otherwise, with previous CAD, if you have any one of you have seen or used, there are so many false positives being highlighted all the time that it actually is very troublesome to use CAD.
I'm Dr. Espiritu from the Philippines. I'm staying in the province in the Philippines, so it was hard for me to get cases. So this bootcamp really helped me. No, I saw a lot of cases, and Dr. Nikita, you were so informative, and you were so kind in answering all the questions. And it was very, very, really informative for me.
Actually, I'm a surgeon. I'm not a radiologist. I joined this bootcamp and the session before the BIE course. I want to improve my knowledge in the breast imaging. For the first time, I think I go to the world course because at the explanation in the beginning, oops, it is for advanced radiologists. I'm so afraid to continue the course, but I follow the course, and your explanation is very simple and easy to follow, and I think I have a great improvement.
I'm Dr. Tauhida. Special thanks to you and your team for arrangement of such amazing program of like bootcamp. Through this bootcamp, I got chance to see lots of cases, mammography cases at a time. It's a great chance for me, and also get a chance to solve our query by you. You are helping me for this type of program. I get all sorts of help from you.
I joined this actually to refresh myself because of this pandemic. I was, stuck up in the house. So I think I will go back to my practice likely this year. So I want to refresh myself. I'd like to thank Dr. Nikita for unselfishly sharing her thoughts in every case that she's showing. So this is kind of refreshed me from, almost 2 years of lockdown. And I hope to join again your future events if you will have again. And then thank you also for extending to us the cases for 2 more weeks.
great experience, lots of cases to do. I was a bit tight. Some of the cases I could not finish in time. I'm glad we have the 2 weeks so that I can go through the cases again. And the cases that Joe presented from unit just now was also very interesting. Thank you everyone for this wonderful program. Thank you.
Hello, Dr. Nikita. I'm Ashwini from India. And it was a very, very nice course. And from selection of cases to the correlation with USG and MRI, everything was good. And I hope to attend next MRI session also. Thank you so much. You and your team has done a very good job.
The course is organized very well and the cases are very representative. Especially I think on my training I have seldom to see some cases with architectural distortion, but I think the cases are very well to give some classic examples to demonstrate how exactly like this working.
Thank you so much for everybody. This is the session. It's very, very wonderful and make me more confident for some cases in my country. I'm so happy for this session and the cases because this is during the work day. I need some information like this session, and thank you everybody for this session.
So thank you very, very much. Appreciate your efforts. Amazing.
Thank you a lot for this bootcamp. It's very nice, informative. You have a lot of nice, challenging cases. You answer all our questions in a very scientific way, and you care all the time about our quiz. So thank you a lot. I hope you arrange more courses, and if you can, it's technically allowed to make it monthly. You book challenging cases or at least 1 or 2 cases to discuss, so something like that. So to make us up and all the time to have continuous education all the time. Thank you a lot. Thank you.
There is no shortcut to comparison. Comparison is going to save a lot of lives, and that's why I do a very diligent comparison for every single case.
On a scale of 1 to 10, where do you rate the course?
I will give it a 9 or 10.
So the rate is 9.5 because 10 may be for cat only.
If I have to rate it, I'll also give it a 9 and a 10, 9 to 10.
But for this course, I will rate 90 out of 100. I think it's very well for those cases.
For me, it's 10. Thank you so much.
Everybody please smile. Say cheese.